welcome back to the CamShell Kids Podcast. I'm Iga. Today I'm joined by Dr. Daniel Niemiec, a chiropractor who incorporates applied kinesiology into his work here in Singapore. Daniel, thank you for being here.
Thanks for having me.
So to begin, I would love to start with your story. Could you share a little bit about your training and what led you to this work, especially applied kinesiology?
Yep, so as you mentioned, I'm a chiropractor, 5-year university trained in Melbourne. I've been practicing for 18 years now. What led me to this was my chiropractor when I was a kid used applied kinesiology. So that's what I thought chiropractic was. And so then I went to school, trained, and then actually went back and studied and worked with my mentor when I graduated. And so they spent a good 3 years training me up as well.
How would you describe your overall philosophy when working with children?
Yeah, so my philosophy in general is very holistic, very natural. I love working with kids. I've worked with kids my whole career, from babies from birth. 1 day old is the youngest patient I've treated. The reason I love working with kids is because we can have such a positive impact at such a young age, which not only is an impact at that point in time, but potentially for the rest of their lives. I've got some young patients that I treat that haven't been at school very much because they've been constantly unwell, and so treating them, getting them healthy, gets them back into school, which then helps their learning.
So when you work with kids, it's mostly kids with chronic diseases or?
No, it's all kids. I've got kids that have different issues. So for example, babies see a lot of reflux and colic, a lot of constipation or gut issues, favouring one side, flat head syndrome, not sleeping, not latching or feeding well, these types of things. Then as they start to get a little bit older, we might see some issues around the development, like crawling or walking if they're not meeting, or talking if they're not meeting certain milestones. I also see a lot of kids with learning behavioural issues, a lot of ADHD, neurodivergence, emotional dysregulation, even some autism and Tourette's and those types of things. And then sometimes we just have kids that have like postural issues. The school bags are so big and so heavy these days. So sometimes they just have some back or neck pain, or they hurt themselves, they have an accident and they hurt themselves. But I have a lot of families that come in and see me regularly for an adjustment, even though they don't have any specific issues. They just come in for wellness care because it keeps them a lot healthier. And that's what I find with a lot of my patients, especially the kids. They're a lot healthier when they're treated regularly because we can obviously keep them healthy, but also pick up issues before they become a problem.
How do you explain applied kinesiology and muscle testing to parents who are totally unfamiliar with it?
So applied kinesiology, it's a really incredible technique. What we look at is what's called the triad of health. So we look structurally, biochemically and emotionally. So all three areas equally affect your health. So we're using the muscle test basically as a key into the nervous system. So we're looking at functional neurology, and we're looking at the way the body responds and reacts to different things and different tests and things like that. So it allows me to get deeper into the cause of a problem. It's also a great test because we can test before to see what the problem is. We can do the correction and then we can retest. So we've got a post-test as well to make sure that the correction worked or that the patient's responding as they should. Applied kinesiology and muscle testing is not diagnostic as such. That's the chiropractic side. That's what we're trained to do as diagnosticians. But the applied kinesiology is an adjunct to that and an assessment tool that we can look at from multiple different angles. So that's how I explain it to patients. And like I said, it's we're looking predominantly at the way the nervous system's working, and then where it's not working, what we need to do to correct it.
So from your perspective, what's happening neurologically when you do muscle testing?
So neurologically, we talk in terms of strong or weak muscles, which is technically not the correct neurological term. The correct term would be facilitated if it's strong or inhibited if it's weak. So what we're looking for either a muscle to facilitate or to inhibit, depending on what we're looking for. So sometimes muscles should switch off and go weaker, or sometimes muscles should strengthen up and become strong. Sometimes I'll place certain things on the body that the patient might react to, which might cause a weakening of a muscle, which shows me that there's either a sensitivity or there's a reaction or there's an excess in something there. And then likewise with a deficiency, a weak muscle strengthens, we might see that the patient's needing something or they're deficient in a particular thing. So that's neurologically, we're looking at the way the nervous system reacts. The nervous system should react predictably, and when it's not, that's when we know that there's an issue that we need to address.
So what are you typically assessing when you do muscle testing? You say that there is 3 pillars, emotional, chemical, and physical.
Yeah. So if we look at structure to begin with, we might be assessing something just like the spine to make sure that the spine's moving and working as it should, or we might assess a joint like a hip joint or a shoulder joint or a knee joint to make sure it's working. If it's not, then we will do the corrections and then retest to make sure the corrections have worked. Structurally as well, we'll look at the ligaments and the muscles to make sure that they're all activated and switching on and off properly. So that's structurally what we tend to look at. We can include things like the jaw in there or the diaphragm, these other types of things as well. Even the cranial bones of the skull and doing corrections there, that can also be structural in nature. Biochemically, we're starting to look at more the biochemical pathways in the body and the organs. So sometimes organs and glands don't function properly. They can either be overactive or underactive. So we look at how do we need to correct and balance those. Do we need to add in supplements? Sometimes people need some support nutritionally, or are they reacting to certain things like diet, foods and things like that? Do we need to remove certain things from their body? Sometimes there might be metals or chemicals that are affecting the system, or even microbes like fungi or bacteria, parasites, viruses, these types of things can affect your body. And so then we're going to look at, okay, what do we need to support that with nutritionally as well? So that's the biochemical side of it. And then the last one is the emotional side of it. Now, there's different corrections I'll do. It relates sometimes to different organs or different meridian systems. So part of applied kinesiology involves the meridians as well. Different organs relate to different emotions. For example, the liver relates to anger or the lung relates to grief. So sometimes there might be too much or not enough energy moving through these particular organs. It might be an emotional issue, like someone might lose a loved one, which can create the grief. And so we just need to support that particular emotional organ. So there's certain corrections that I'll do around that. I had a patient currently that I've only seen a few times, but he's very impulsive, and I've been doing a lot of emotional corrections on him, and within a few sessions he's already calmed down a lot, and that's just doing emotional work with him.
Emotional work through physical adjustments?
Not so much adjustments, but more through there's different organs have different reflexes associated with them, so sometimes we might need to correct the reflexes through rubbing or tapping, these types of things. Sometimes different spinal segments can relate to different emotions, so we might have to do an adjustment, but more often like tapping through the different segments of the spine as well. And then sometimes we might need to support that as well nutritionally. So, the particular organ might need a certain mineral or vitamin or something like that just to help it whilst they're passing through that emotion.
How much of a support do you need from parents when working with kids?
With kids, so we talk in terms of active care and passive care, okay? So active care is me doing the work, passive care is you doing the work. So, for example, in an adult, I might say you need to ice your low back. And so I can do all the adjustments, but they need to do that at home to help with the results. Kids are the same. So if I say to a parent, you need to reduce or eliminate this from their diet, then they're going to need to work on doing that. Otherwise, we're not going to get the result. Or sometimes when I'm doing different corrections around reflexes and stuff, different neonatal reflexes, I might give them exercises to do, like a marching exercise. So they need to be doing that because that helps enhance the correction. Or I might prescribe a supplement. So they need to make sure that they either give it to their child or the child's taking it to get the results properly, yeah.
How do you interpret what you see during muscle testing? Is there differences between practitioners?
Yeah, I think it takes a long time to become really skilled at muscle testing, for sure. The patient's position can interfere with a test. For example, if a patient has their glasses on while we're testing, that can affect the testing. Placing things on the body in certain positions can be like therapeutic or not therapeutic. So, and also too, when you're testing, you have to remain very neutral because I can't expect to find something because then I'm more likely to find that thing. It's not a proper and true test. So it's really important to stay very neutral when testing as well. With kids, especially babies and things like that, with babies, obviously I don't test the baby, they're too young, but I test through mum or dad. It's called surrogate testing. With babies, they can't tell you what's wrong. So you need to go in and figure it out yourself. And so that's where you need to be quite intuitive as well and really present with the child to make sure that you're working to get the best result possible.
How individual is the treatment you're providing? Let's say we have two kids with the same symptom. Do you approach them in the same way, or it's very individualized?
Very individualized. There's never two people that are the same, even if their symptoms are the same. Yeah, they could have the same thing or a similar thing causing it, for sure, but it also could be very different. So to go in and think that this leads to this, no, it doesn't work that way. So every single patient is individual, the care's individual, what I'm thinking through my head is individual for every single session on every single patient.
What are retained neonatal reflexes in simple terms?
So neonatal reflexes are reflexes that develop in utero, and they're basically survival reflexes. Within the first 12 to 18 months of life, they'll integrate back into higher brain centres, and then we develop our postural reflexes that we have for the rest of our life. But sometimes the reflexes don't integrate properly, and that's where they become retained, so dominant basically. They can cause a bunch of different issues, from balance and coordination problems, gross and fine motor skill issues, visual problems, hormonal imbalances, speech problems. There's a whole range of different things that the reflexes can contribute to if they're retained. I typically find that kids with learning and behavioural issues tend to have these reflexes retained, but not always, but that tends to be more the case. Occasionally I do find them in adults as well, and they can come back out at different points in life, often if there's like a really traumatic event that causes them.
What kind of patterns might lead you to test it? Is it something that you visually can see, or?
Generally, or sometimes yes, but generally patients or parents will bring their kids in if they've got a particular condition like ADHD, like neurodivergence, autism, these types of things. It might be a diagnosed condition, or it might be an undiagnosed condition. They might be really hyperactive, or they might be impulsive or withdrawn. They might have speech difficulties, these types of things. So typically there'll be symptoms associated with them. And then if I suspect that there might be retained reflexes, then I'll go through and start to test for them. Most of the time I will find them if I suspect that they're present, but sometimes I don't. Sometimes the kids surprise me and they don't have those particular issues. It's something else causing it. But yeah, it's generally from the history, from the examination, from my observations of the child, that I'll go and start to look into them. basically the treatment is really precise craniosacral therapy. So each reflex has really specific corrections associated with it to help integrate the reflex. The reflexes are associated with different meridian systems and also different neurotransmitters in the brain. So we'll work and look at those biochemical pathways, for example, with the neurotransmitters. Sometimes there might be nutrition that's required to support the reflex correction. Sometimes there might be dietary recommendations. And then even some physical exercise, as I mentioned before, about marching. Because neurologically with these kids, when they've got reflexes, they're often overstimulated already. And so little things set them off even more. So we're working on, again, calming the nervous system down. And you see, like with the marching exercises, like to begin with, they might not be able to go for very long. And then after a period of time, they can just keep marching and marching because it's not overstimulating the nervous system anymore because the nervous systems can cope with it. One thing that's really important with the reflexes is that we allow them to integrate naturally. So, for example, some of the reflexes that come a bit later, they might not integrate until 12 to 18 months of life. So we don't want to touch them. We want to let them integrate naturally. And it's only after that point, if they're not and we're seeing some symptoms, that's when we'll assess for them and then correct if necessary.
Are there situations where you would recommend additional evaluation or different type of support?
Yep, definitely. I work with a number of different practitioners already as it is. I'm linked up with a lot of the pregnancy networks in Singapore. So I do already work with lactation consultants and doulas and midwives, physiotherapists, occupational therapists, and people like that, even PTs. I think having that network and that team around you is really, really important. There's certain things that I can't do that I might need to refer for. For example, if a baby comes in, I suspect there might be a tongue tie. I might refer to a lactation consultant or to the dentist. There might be other times, like say, postpartum women that need help with their pelvic floor. I might refer them to physios to help with that, or PTs to help with their recovery. So yeah, I work with a lot of different practitioners, and I think it's really important that we do, because when we have a team around us, that's when we can really get the results.
How do you understand the gut-brain connection in children, and how does it show up in practice?
Yeah, so the gut is commonly referred to now as the second brain, because we're understanding how vital it is, and a lot of that is because of the connections neurologically. There's the what's called your enteric nervous system, which is the nervous system through the gut, is intricately linked with the brain. Also, you have the vagus nerve, which a lot of people have probably heard about. That's your most important nerve, sort of from the head down, and does supply the gut. So, talked before about the sympathetic and parasympathetic activity. The vagus nerve is parasympathetic, so we actually want to improve the function of that nerve. For example, so it comes from the back of the skull here, for example, and supplies the stomach. So sometimes in babies, if there's cranial issues here, then it can affect the function of the nerve, which then can affect the messages that go to the stomach and contribute to things like reflux. The other thing is, in the gut, 90% of your serotonin, which is a neurotransmitter that helps regulate mood, is produced in the gut. So if your gut's not working properly, then that's going to affect serotonin production, which can contribute to conditions like anxiety and depression. We're seeing that in children now, and not even teenagers, but even younger kids. 70 to 80% of your immune cells are in your gut. So if your gut health is poorer, then it's going to directly impact immune function, and that's where your kids will start to get sick more often with colds and flus and ear infections and those types of things as well. And then we've talked about diet and things like that, and the importance of diet in terms of gut health. So gut health is vital. It's an area that I do a lot of work in with a lot of my patients, not just kids but adults too, especially babies. We see a lot of issues with babies. Breastfeeding, it might be mum that's eating something that's irritating the baby. That's a really common one with like reflux. Dairy would be the most common one in that space. So sometimes removing dairy can help with the reflux. So yeah, it's and then as kids start to move into solids and things like that, and then get older, we know the diets are really poor these days, and the quality of food's not what it used to be. So it's even more important that we take care of our gut and gut health. I do a lot of work in terms of microbes and infections, so like fungi, bacteria, parasites, viruses. Here in Singapore, we're global, so we're all travelling in and out of the country all the time. So a lot of things are being shared around, and as everyone knows, it's a parent, kids love to share their tummy issues and their illnesses and things like that. So it's really important that we're treating those as we find them, so that they don't become an issue later on, because the gut can start to be affected more long term. Things like leaky gut and that type of thing, which people probably heard of, can occur if we don't treat the issue as it arises.
So when you talk to parents about diet, how do you approach these conversations? Kids have access to certain foods that we know that are bad, but not everything is under parents' control.
Yeah.
So how do you start the conversation about that?
I think it depends on the age of the child. I think in the end of the day, it's about education. So explaining to the parent what I'm finding, how it's impacting their child, and then the results that we're going to see by not having it. Well, sometimes it might be reducing it, sometimes it might be eliminating it. In the end of the day, the results are what speak for themselves. So if we reduce or eliminate something and we see the changes, the parents obviously can see that. With kids, as you said, sometimes, as they get older and they're in school and stuff, you don't always have control over it. But it's as much as I'm educating the parent, it's important for the parent to educate the child as well. But they still eat a lot at home. And so, if I'm saying to a parent, look, I would recommend that your child doesn't eat gluten, for example, then they often will remove it from everyone's diet because they don't want to cook separate meals and things like that. So then the whole family start to change their diet and become a lot healthier. And even the parents sometimes will see the differences and the changes from that. So where we can, trying to educate and then educate the child on, what's good food and what's bad food, educating them on, look, if you eat this, can you see how you reacted to that? Because, even kids will see it. They're like, if I have a glass of milk, then my tummy feels funny. So trying to educate them on the direct result from that particular food. It's not always easy. Compliance can be a real tricky one, especially, I mentioned some of the kids I see, ADHD and these types of issues. It's even harder. And also if a child's been eating something for a period of time and, it's hard for them to understand, well, why do I need to remove it now?
How individual it is in terms of, you say your approach to treatment and kids is very individual, but in terms of diet, we hear a lot, now gluten is bad, now dairy is bad. It changes, but is it really individual, or there is some kind of guidelines that you give parents to follow?
It's still very individual because it's based on what I'm finding through my testing. You mentioned gluten and dairy. Yes, they're inflammatory for all of us. Would I recommend everyone reduce or eliminate them? Yes, if you want to be healthier. But if I test a child and they don't test up positive for dairy, that they're reacting to dairy, then I won't necessarily say you need to stop having dairy. So it's still very individual based on what I'm finding. There are some food toxins or foods that are far more common, like gluten and dairy. They're really, really common. Eggs is another one. Soy is another one. So these are the ones that we find a lot more regularly. But then there can be some others that are not as common. And even getting really specific with it, I have patients bring in foods that they think they might be reacting to or their child might be reacting to, and then I'll test them. So sometimes we might even find healthy foods that the child's reacting to, so different fruits or vegetables.
Is it related to allergies?
Can be. But it's a bit harder with kids, but it's about having an awareness of our body and listening to our body. And most people know, and even parents, they generally know if I feed my kid this, that they're going to react poorly because they see that reaction in them. And then also too, if we're going to remove something, how do we replace it?
Nutrition-wise?
Well, nutritionally, but also just in terms of the food, because we need to be eating enough. And sometimes with kids, it's hard to understand, well, why can't I drink milk? But then the flip side is some of the replacements are just as bad. So we don't want to necessarily just use a replacement if it's actually going to affect you as well. For example, if we say don't have dairy, so don't have milk, then, alternatives are oat milk, rice milk, almond milk, soy milk, but they can be just as bad for you. Or gluten. There's a lot of gluten-free products in the supermarket, but they're no good for you because they're full of salt and sugar and soy and processed stuff. So we don't want to be replacing with something that's bad. There's staples in our diet. Bread's a staple, milk's a staple. And people think we need these things in our diet when we actually don't. But again, it's also complex because there's hereditary diets, there's genetic diets, there's blood type diets. So there's different things. So we don't want to be just giving generic advice. It's really important that the advice is specific for that patient because that's what they need to improve or to get better or to get healthier or to stay healthy.
And with processed food nowadays, how trickier it is for you to test it and see what's affecting the kids?
It makes no difference in terms of testing because I can check easily enough whether something's affecting someone or not. But the fact that there is so much processed food out there and the food industry has designed it to make it very addictive for us, and it's targeting different parts of the brain, and that's not only in adults, that's in children. So children don't understand. They just find something, they eat it, they like it, but they don't realise that it's designed to not make them full, so they want to keep eating more. They don't realise it's full of sugar and full of salt and these types of things as well. So processed foods is a huge issue. I think now in the US, I think the stats are that the people eat more processed food than whole food. But in the US now, the chronic illness rate in children is 50%. So we shouldn't be seeing those numbers at all. So diet has a huge role to play in our health and the health of our children. And that's why it's so critical that as parents, we're teaching our kids when they're young what good food is and what healthy food is and what whole foods are, because that way, as they get older, they're going to make better decisions. They're not going to make the best decisions all the time, but ultimately trying to help them make better decisions as they become more independent as they get older, and then pass that on to their kids. And so we can work through the generations, and that's how we can, through one patient, impact a lot of people.
Can applied kinesiology be preventive or it's more solution-based?
No, definitely preventative. Like I said before, I have a lot of patients that come in regularly just for a checkup, just to keep on top of things. And I can test. I can test for different things, make sure things are not showing up. For example, like in the gut, we can check if you go on holiday to Bali or Thailand, come back, we can check, make sure there's no parasites, these types of things. So it's really important as well that preventative care is much better. Ultimately, that's what we want. And that's where, when I'm seeing parents and mums and babies and stuff, we're starting at the beginning and we're just working, it becomes part of their lifestyle to have preventative care. And typically and generally speaking, these children grow up a lot healthier. Now, if you don't start at the beginning, it doesn't mean it's too late, because we can start at any stage.
So from your perspective, is your field of applied kinesiology changing and evolving?
Yeah, it's like science. All science is constantly evolving, constantly looking at new research, new techniques, and applied kinesiology is no different. So there's constantly research that's being developed by people all over the world, particularly in the US and Australia. We're learning new techniques, new modalities, new ways of putting things together, new protocols. So it's constantly evolving. We have to, otherwise we're falling behind. So our aim is to always help the patient as much as we possibly can. So part of our job is to stay on top of the current trends, the current techniques, the current science, and continue to develop that.
And how the research is conducted for treatment types that are very individual?
Yeah, you can't do what's called randomised double-blind controlled studies, which is basically the highest level of research, because we're talking about a patient. But with all research, it starts with one person, one patient. You might find something. And so then you start to look for patterns amongst other patients. And then you might get a handful of patients where you're seeing the same thing. And then you start to develop a particular technique. And then you can start to control it a little bit more. But the flip side of it is people are often always wanting research, but it doesn't quite work that way sometimes because we're talking about an individual and there's no two individuals that are the same.
And there is not the same treatment.
There could be different treatments on different patients. It's important that we're continuing to develop and learn new things and continue to evolve as science evolves and things like that. But it's also very important to remain individualistic with a patient.
Thank you so much. That was such an insightful conversation. I think it brings a lot of clarity for parents.
I'm glad. Thank you.
Thank you.